Hey guys, it's Sarah here. In this video, I'm going to be going over all the lab values that you have to know for the NCLEX-RN. What I'm going to do is I'm going to state what's normal, and I'm also going to explain a little bit what it is so you understand that what happens in the body if it's abnormal and what systems are affected. So before I start, I just want to let you know that any of my NCLEX videos comes along with PDF notes that you could get at my website, www.sararn.com. You could also get the full comprehensive review for the NCLEX there. So let's get started. So we're going to start off with vitals. Vitals are very important because they tell you what's going on in the body. If the patient is decompensating, where your focus is, high temperature, they're having an infection, the blood pressure is dropping, hypotensive, the pulse ox is off, respiratory problem, like that. So that's your baseline. So the first thing is the blood pressure. What the blood pressure is, it's the force of the heart on the wall of the arteries every beat. So you have a systolic and a diastolic. Systolic is the top number, diastolic is the bottom. So systolic is the same thing, it's the force of the heart on the wall of the arteries. It's just during the beat, so the actual pumping beat. And the diastolic is just in between beats, so the resting state. So obviously you're going to have less force on the wall of the artery when it's resting than when it's beating. So the top number is going to be higher. Normal is 120 to 140 for systolic and 80/90 for diastolic. If someone's blood pressure is high, it's usually because there's a greater force that they have to contract against. So it could be like a plaque, atherosclerosis, like the wall is more stiff. Next we go on to pulse. Pulse is the same thing as your heart rate. And as the name heart rates, it's a rate. So it's how fast it's going. It's the amount of times your heart beats per minute. Normal is 60 to 100. If someone goes too fast, that's tachycardic, so above 100, it means that the heart is not really relaxing and it's not emptying properly. And if someone goes too slow, that means that there's not enough blood getting out as fast as it should. Next we go on to temperature. So a normal temperature is 97.7 to 99 Fahrenheit, 36.6 to 37.2 Celsius. What temperature was telling you is how well your body could get rid of heat. It's very good to know because if someone's high, that means it's a fever, so you're thinking in terms of infection, stuff like that. And if someone's too low and they're cold, you're thinking in terms of shock, not getting enough blood around. Next we go on to pulse oximetry, which most people call pulse ox. A normal pulse ox is 95 to 100%. So what this is telling you, it's the measurement of the oxygen level in the blood. 95 to 100 is normal. Anywhere between 90 to 95, you would put someone on nasal cannula, and then below that, you would do further. If they're not maintaining above 90, then you would do further interventions. The next one is capillary refill. So what that is that it's the amount of time it takes for the color to return after you apply pressure to the skin, like it's usually like the finger. It's supposed to be less than 3 seconds, and if it is, it says that the person has good circulation. If it's not, it takes longer than that, then it shows that it's poor circulation. Now let's go on to the ABGs. So arterial blood gas, I made a whole video on that, so you could just watch my video. So I'm not going to go over each exact one. I'm just going to go over what the normal values are. But what they show you is that they show you the balance of oxygen, carbon dioxide, and acid-base balance in the blood. So the carbon dioxide and oxygen balance will tell you how well the respiratory system, so how well your lungs are working, and your acid-base balance will tell you how well your kidneys are working. And they'll both compromise for each other. Okay, next we go on to CBC, complete blood count. So the white blood count is what is used to fight infection. So normal is 4,000 to 11,000, and if it's elevated, that means your body is fighting an infection. It doesn't tell you where the source of infection is, but it means that you're fighting an infection. And you see at the end of the slide, it says leukocytes. I don't know why I did them separately, but it's the same as the white blood count, which is, as you see, the same number. Next, we go on to platelets. So what platelets do is that they help the body form clots to stop the bleeding. So if there's too little platelets, you're going to have thrombocytopenia, which means that it's not really forming clots, so you could bleed out. Normal is 150,000 to 400,000. The next one is absolute neutrophil count, ANC. So what neutrophils are, they're a type of white blood cells that fight infection. So normal is 2,200 to 7,700. I've never seen them ask that exact number. It would more like the white blood count that they want. But anyways, neutropenia that's what you should know, is that when it's below 1,000. If it's below 500, it's severe neutropenia and it's a critical emergency. Because then they have nothing to fight against if they get a common cold or something that could overtake their body. The next one is eosinophils, which is like a specialized type of white blood cell that so for that it like boosts inflammation. Normal is 1 to 2%. Okay, so now we go on to some lab values. Albumin. Normal albumin is 3.5 to 5. What albumin does is that it keeps the fluid in the bloodstream so it doesn't leak. And it's made by the liver. So if that value is off, it's going to tell you the liver function is not doing well. The next one is BUN, like blood urea nitrogen. What this does is that it removes it from your body. So basically, if that's off, it's telling you the kidney function is not working so well. Normal is 6 to 20. Creatinine is a waste product from muscle activity. The kidney, as we said, removes the waste. So if that's not good, then it's showing you that the kidney is not functioning so well. So creatinine and BUN are both indicators of kidney function. Creatinine normal value is 0.6 to 1.3. Now we go on to hemoglobin. Hemoglobin is a part of the red blood cell that carries oxygen from the lungs to other parts of the body. So for males, it's 13.2 to 17.3, and females, 11.7 to 15.5. And I didn't add this in, but hematocrit, which is like abbreviated HCT, shows you how much red blood cell the body's making. So if those are low, it's symbolizing anemia. The next one is ALT. What ALT is an enzyme made by the liver. So I wouldn't necessarily know those exact numbers, but just know that if it's out of range, it shows liver function. Because if it's made by the liver and it's out of range, then the liver function is not working so well. The normal one is from 10 to 40. The next one is urine-specific gravity. So this is used a lot. What this is that it compares the density of urine to the density of water. So basically it tells you how well your kidneys are working and diluting urine and how hydrated you are. So this is a very specific value, 1.003 to 1.030. So in general, like, you wouldn't really have to know the points. Like, they wouldn't ask on the NCLEX, for instance, for albumin, the person's albumin is 3.4. Is it high or low or something like that? Because what they want to know is if it's a little off, it doesn't really make a difference. Certain ones make a difference if it's a little off. So like potassium would make a difference because that affects the heart. For albumin, if it was 3.4, it wouldn't really make a difference. They wouldn't ask that. It would either be like much higher or much lower than the normal value. But for urine-specific gravity, it's a point that you really have to know. So it's 1.003 to 1.030. The next one is called ESR, erythrocytes sedimentary rate. So as the name says, it tells you how quick erythrocyte, which is red blood cell, settles at the bottom of a test tube. So basically, if it's too fast, inflammation in the body. I haven't really seen that much either. And what you want that is to be less than 30. So the next one is CSF, cerebral spinal fluid. So the normal pressure for that is 60 to 150. Then goes C-reactive protein, which is CRP. So if that is high, it's telling you that there's inflammation going on in the body. So then again, it's not specific, so it's not telling you exactly where, but it's just telling you inflammation is going on in the body. Okay, so now we go on to other values that you have to know. So we're going to start with BMI. What BMI does is that it assesses the height to weight ratio. So it's telling you if it's too high, you're at risk for obesity-related disease. It's too low, anorexia, stuff like that. But one thing you should know with BMI, it does not take muscle into account. So if someone works out using dumbbells and stuff like that, and they have a lot of muscle, it might show that they're overweight or morbid obesity even, but they're perfectly healthy. So that's why it's not such a good indicator for someone who's like muscle builder and stuff like that. Normal is 18.5 to 24.9. Okay, so next we go on to urine output. So this is actually very important to know because with critical patients, it shows how much they're retaining, how much urine they have. It's very important to know. So normal urine output is 0.5 to 1 milliliters per kilogram per hour, or you want more than 30 milliliters per hour. So if they have low urine output, that means they have kidney failure, because remember, the kidney produces the urine. So if it's kidney failure, it's going to have you're retaining the urine. Or it just means that there's very little supply to the kidneys, so they're dehydrated, they're not drinking enough. Next we go on to the CD4 count. So that's 500 to 1,200. So that's just a type of white blood cell count. It should have been part of the other page. The next one we go on to is the glass coma scale. A normal glass coma scale is 15. The minimum one could get is 3, not 0. There's 3 different categories for it, and it describes the level of consciousness in the person after a traumatic brain injury. So it's divided into 3. The first one is eye-opening. So it's divided into 3. It assesses the eye-opening, the verbal response, and the motor response. So if someone has none, for all of them, they're going to get a 1, 1, 1, so that will equal a 3. So if someone has severe brain injury, then it would be 3 to 8. Moderate brain injury, 9 to 12. And mild, 13 to 15. Next we go on to deep tendon reflexes. So this is a neuro exam that is used to assess after like a brain lesion or injury. So you want to assess the motor functions. So, like the hammer and all those stuff. Normal is 2+. So if let's say they're banged and then they have the normal reflex, then it's 2+. The next one is TSH. TSH stands for thyroid stimulating hormone. So it's released by the pituitary gland, and it helps your thyroid gland release the hormones T3 and T4. So normal TSH is 0.4 to 4.2. Normal T3, 70 to 204. T4 is 0.8 to 2.7. I don't really think you have to know those exact numbers. But TSH, what it does is that if it's high, then it means hypothyroidism. And T3, T4, if it's high, it means hyperthyroidism. So they have an inverse relationship. If TSH is high, it's hypo. And if T3, T4 are low, then it's hypothyroidism. Okay, so now we go on to the cardiac. So first we're going to talk about the cholesterol levels. Fasting total cholesterol, you want less than 200. LDL, you want less than 100. Triglyceride levels, you want them less than 150. And HDL, you want them more than 40. So your HDL is your good cholesterol, your LDL is your bad cholesterol. And what cholesterol and triglycerides are is that they're a type of fat in the blood. So if it's too high, it means that there's cardiac and circulation problems. And they could clog the arteries and stuff like that. The next one is the MAP, mean arterial pressure. So this is important also, and I would also know the formula to calculate it. A normal MAP is 70 to 105. What it's telling you is, it's telling you the average pressure in the patient's artery in one heartbeat, in one heart cycle. So if it's too high, that means there's too much pressure. A MAP equals to the systolic blood pressure plus 2 times the diastolic blood pressure, and all that divided by 3. So this is used in critical patients if they're very hypotensive. So you just want, a lot of times they'll tell you, just focus on the MAP and keep it above, let's say 65, like that. The next one is troponin. Troponin is released when there's heart muscle damage. So it's an indicator of an MI. KMB is creatinine kinase. So that's a heart marker test. So it's an indicator of an MI and heart stuff also. D-dimer is telling you that a blood clot is forming. But it's not telling you exactly where. So you'll know that the patient has blood clots, but it's not saying where. So what people like to look for is a pulmonary embolism. They look at the D-dimer, like that. The next one is BNP. BNP is used to see if someone has heart failure. BNP should be more than 100. So BNP should be more than 100. Next one is cardiac output. Cardiac output is the volume of blood being pumped out. So it reflects the output, so by the left ventricle. So that's 4 to 8. And the CVP, the central venous pressure, is the blood pressure in the central veins, near the right atrium of the heart. So that reflects the amount of blood returning to the heart. So it's telling you the right atria pressure. So the pulmonary arterial wedge pressure should be 6 to 12. That is an indirect estimate of the left atrial pressure. I haven't really seen that asked. The pulsus paradoxus is, so what that means is that it is an indicator of cardiac tamponage. So it's a big decrease in systolic blood pressure during inspiration. Now we go on to the bleeding and clotting. So with this, you have APTT, PT, and INR. The APTT, which is activated partial thromboplastin time, is the one that's done when someone's on heparin, and the other two, the PT and the INR, are done when someone's on warfarin. So all these three are lab values that tell you the time it takes for the blood to clot. So the APTT or PTT, same thing, it tests the ability for a clot to form. So the therapeutic level while someone's on heparin, you want them to be between 46 to 70 seconds. If someone's too high, it means that spontaneous bleeding could occur. The PT, like I said before, is on warfarin. The therapeutic range for that is 11 to 16 seconds. So what this does is it evaluates the ability to form blood clots. The same thing before. The INR just uses the results from the PT, tells you the same thing, how fast the blood is clotting, and it's also done on warfarin. So PT, warfarin, INR, warfarin, APTT, or PTT is heparin. And just know the amount of seconds it takes. And the therapeutic level for the INR, if someone's on warfarin, is 2 to 3. So next we go on to glucose and diabetes. So you want the fasting glucose, so that means they didn't eat anything, to be between 70 to 100. So the fasting glucose tells you how much sugar is in the blood sample after not eating. The hemoglobin A1C tells you the average blood sugar for the past 3 months. So if you do a fasting blood sugar, it could be elevated because they just ate, but it doesn't tell you how they're maintaining themselves at home and how they usually are. So the hemoglobin A1C should show you the past 3 months. So next we go on to electrolytes. Electrolytes are very important, and if they're a little bit off, that could cause really detrimental stuff in the body. Like potassium affects the heart, so if that's a little bit off, that could affect the heart, could cause arrhythmias and stuff like that. So I would know these exact values. So the sodium, 135 to 145, calcium, 9 to 10.8, phosphorus, 2.5 to 4.5, potassium, 3.5 to 5, and magnesium, 1.5 to 2.5. And remember, each of them affect different ones. So the phosphorus would affect strong bones and teeth. So I would just remember these stuff for the infant. The infant is someone under 1 year old. You want the baby to have wet diapers between 6 to 10 a day, or 1 every 4 hours. And that's very important to assess in a newborn. The infant urinary output will be 2 milliliters per kilogram per hour. And a newborn head circumference, normal, is between 12.5 to 14.5 inches. The heart rate would be elevated, so it would be 100 to 160, which is normal. The respiratory rate, as you see kids, they breathe much faster, 30 to 60 beats per minute. And the hemoglobin would be 12.5 to 20.5. The temperature would be the same, 97.7 to 99.7. And the blood sugar would be 40 to 60 within the first 24 hours after delivery. Okay, so next we go into cranial nerves. So I know there's a lot of different mnemonics that people use, like the first letter in each one. So this is just a good one to remember. As you see, there's one nose, so then you remember number 1, cranial nerve 1 is olfactory, smelling. There's 2 eyes. You remember cranial nerve 2 has to do with the eyes, I would just read this over, and it's important for you to know. And then that's it. So those are all the lab values that you have to know for the NCLEX-RN. Please subscribe, like this video, and you can purchase all my NCLEX review notes on my website, and enjoy.